Welcome to Adapt NCLEX. 10 questions, pharmacology questions, same style you're going to see on the NCLEX or when you're taking nursing school exams. I'm going to walk you through it, give you the strategy to answer them, critical thinking, and how to approach them. Are you ready? Question 1, start now. How do you approach the question? Read it from the back. Which statement require follow-up? And Nancy is teaching a client about phenytoin therapy for seizure disorder. How do you answer the question? Don't look at the answer choice. Try to find out what the question is asking you. I call it buzzword. The first buzzword is what? Follow-up. Something is wrong with these 4 answers. About what? Phenytoin. What do you need to know about phenytoin? Is the content. So your ask is follow-up. What is the buzzword? Is the phenytoin and follow-up. And the content, what do you need to know about phenytoin? That's all. I will avoid alcohol while on this medication. Of course, this is a seizure medication. You should not take alcohol with that. This is gone. You don't need a follow-up. I should see my dentist regularly. Phenytoin, the content, it causes what? Gingival hyperplasia. You should see your dentist. I should take the medication with milkshake. Milkshake is a bunch of protein. Phenytoin hates protein. You should not add protein to that. Therefore, we have a problem with this question. I may experience some drowsiness. Of course, it's a seizure medication. It can make you sleepy. It can cause orthostatic hypotension. Therefore, this is okay. Which of this you need a follow-up? You should not take protein with phenytoin. This is the concept. I'm going to show you each of them. Bring your buzzword, bring your content, and use it to approach each question one by one. And you can see that the questions are not difficult, but they are a strategy to approach them. Avoid high protein diet with phenytoin. Take a pen of paper, every answer choice, every question, I'm going to give you keywords, and they will come out as a flag, like you see over there. Write it down so that when you see phenytoin, think about that. Next question. A nurse is providing teaching to a client prescribed levothyroxine for hypothyroidism. Which instruction should the nurse include or not include? Forget about it. Read the question from the back. Which instruction should the nurse include or not include? That means this is a next generation format you will see on NCLEX or nursing school. Therefore, I want to know whether I should include it or not. This is the same thing as selected apply. Forget about the table, take away the table, think about it as a simple question, and then go for your buzzword. And nurse is providing this teaching to a client prescribed what? Levothyroxine for hypothyroidism. There's only 2 information in the question. I call it the buzzword you can use. Levothyroxine, that's all. And include, that means you need to bring your content regarding this pharmacology. What is levothyroxine? I've given you a clue. That means the patient is what? Hypothyroid. Therefore, this medication is a thyroid medication. Therefore, what do you need to know about thyroid medication, specifically regarding levothyroxine? Take this medication on an empty stomach. Yes, you should not eat with it with a full glass of water. Take it with a full glass of water. Take this medication with iron supplement to enhance absorption. Iron, calcium usually affect absorption, including antacid. You should not take it with it. Therefore, that one is not right. Expect improvement in energy level within 2 to 4 weeks. It takes some time. It's a steroid. Therefore, this is appropriate. It is safe to take this medication with what? Enteral feeding. First answer choice said what? Empty stomach. Therefore, test taking strategy number 4 is inappropriate. Empty stomach. Take this medication with calcium supplement to enhance absorption. Calcium, iron, antacid affect absorption of levothyroxine. Therefore, this is inappropriate. Remain upright for 30 minutes after taking the medication. What do you think? Therefore, this is appropriate. So these are NGN type of questions regarding pharmacology. And the key about levothyroxine, It's no iron, no calcium, no antacid, empty stomach. If you want to remain upright, 30 minutes in order to prevent esophagitis. But these are concepts I want you to know and write them down. This is a dose calculation. It's a safe calculation. Don't worry, I got you. These are straightforward questions. The question will be a lot of information, but when you do the calculation, it's straightforward. You got to know what you should be looking for. A provider orders what? Amoxicillin 400 milligram PO every 8 hours for a child who weighs 22 pounds. The safe dose range is what? 20 to 40 milligram per kilo per hour divided every 8 hours. When they give you a dose calculation, don't freak out. Just go for what you need to answer the question. What I've been given, available dose is what? 400 milligram every 8 hours. So this is the prescribed dose. Prescribed dose is 400 what? Every 8 hours. That means we're going to give it 3 times and we're going to get what? 1200 milligram per day. This is what you're going to give to the patient. But what is the safe dose? They said 20 to 40 milligram per kilo per day. What is the key? I give you pound, 22 pound. You convert 22 pound into kilos, which is 22 over 2.2, which is what? 10 kilos. Now, convert the 10 kilos provided to the safe dose. The safe dose is what? 20 milligram per kilo. That means 20 times 10 per day, which is what? 200 milligram per day. That is the lowest safe dose. That is the lowest safe dose. Then 40 times 10 milligram will give you what? 400 milligram per day. That means your safe dose range is 200 to what? 400 milligram per day. What is the prescription? 1200 milligram per day is too much. It's out of the range of the safe dose. The maximum safe dose is 400 milligram. We have 1200 milligram. That means 3 times the maximum safe dose range. Therefore, this is not safe and the nurse should hold the medication. This is how you calculate safe dose. And the strategy is what? I call it CDR, which is the same thing as what? Find the weight in kilograms based on the gram, if they give you pounds. So the pounds divided by 2.2. Then what? Calculate your safe dose range, which is the dose given times the weight. That's the safe dose you're giving. Then compare it to the prescribed dose. Compare the other dose to the safe dose range. 400 milligram every 8 hours is 1200 milligram. This is more than what we were prescribed. And therefore, this is how you approach this kind of question. If you need more, stop the video, repeat this several times. I have one more. Stick around for one more safe dose question so that you can see how you approach it. Number 4, a client prescribed what? Lisinopril report a persistent dry cough. Which action should the nurse take? Once again, read the question from the back. Action you should take is the buzzword. Now, a client prescribed what? Lisinopril aceclidine with what? Persistent cough. That means my buzzword is I have to take action when the patient is taking lisinopril and they have persistent cough. Bring your content. You said, is this a major side effect? Of course. But lisinopril side effect is what? Angioedema, cough, electrolyte problem, and teratogenic. But is this dry cough a major problem? What do? I'm not asking you for whether it's a major problem. Application. Advise the client what? Advise to take the medication with food. Is that what you're going to tell the patient? Anticipate medication change to a beta blocker. If you're taking an ACE inhibitor and you're coughing, do I change it to a beta blocker? Administer an antihistamine to help with the cough. Anticipate medication change to what? Angiotensin receptor blockage. The concept is ACE inhibitor and ARBs are almost the same. The problem, there's no cough and there's no angioedema with ARB. Therefore, if you're taking ACE inhibitor and it's working and you're coughing, we're going to change it to what? ARB. That is the content. Write it down. Every time you see this kind of question or similar one, this is the way to approach it. NCLEX practice question, pharmacology review for nursing student, NCLEX questions and answers, strategy using critical thinking to answer these kind of questions. Let's go. Number 5, what is your score? Put down in your comment. A nurse is caring for a client with what? Cirrhosis and ascites. Which prescription should the nurse question? Put it down. Tell yourself, I'm ready. I'm going to answer this question. Put it in the comment, said, I'm ready to go. What would you do? A nurse question. Which prescription should the nurse question? That is the buzzword. And the next one is what? Ascites and what? Cirrhosis. And you have to question. That means one of these medications cannot be used in the patient with what? Cirrhosis and ascites. Breaking down the question in the easy form. Cirrhosis, ascites, and the next question. Question the medication. Acetaminophen, lactulose, spironolactone, and ketorolac. Then connect to that. Cirrhosis, ascites. Well, you have a liver injury. What medication you should avoid? Acetaminophen, lactulose, spironolactone, and ketorolac. Think about it. Lactulose, you develop encephalopathy, we can give it to you. Ascites will give you spironolactone. That's what we use for cirrhosis patient with ascites. Now you're left with acetaminophen. I know you know that we should not give anything that will affect the liver. But ketorolac is an NSAID. It's worse when you have ascites. When you have ascites, you have too much fluid. We should not give you anything that will cause too much fluid. If I give you ketorolac, which is an NSAID, it affects your kidney. Now you can get rid of the fluid. So ascites patient or cirrhosis patient are more likely to avoid NSAID than acetaminophen. We can minimize it, but any NSAID can affect the kidney and it worsen the ascites and your condition change. This is a critical thinking question. Most people will pick acetaminophen, but this is the purpose of the video to tell you when you see cirrhosis and ascites, pick an NSAID. It's worse than what? Acetaminophen. So that is the key for this question. Avoid NSAID in cirrhosis with ascites. What a retention. We can give low dose acetaminophen in these patients. So this is the concept. Number 4 is the wrong answer. And this is caring for a client with what? CHF who is receiving Digoxin and Bumetanide. What is the key? Buzzword, Digoxin, medication for your heart. Bumetanide, medication for your heart. I've told you it's for heart failure. Don't worry about it. But why am I asking you? Which action should the nurse prioritize? 2 medications, combine them. They may not like each other. When you see questions like that, there's a reason why you're being asked that. What do you think? Digoxin, if your potassium is low, we have a problem. Bumetanide, if your potassium is low, we have a problem. Therefore, combination of this is a problem. And you got to be serious and watch the patient. Therefore, which one would you prioritize? For the medication, if apical pulse is less than 70, assess for muscle weakness. Encourage increased fluid intake. Measure daily abdominal girth. Think about it. Of course, you have CHF. I'm going to see if you're retaining fluid. I'm going to measure abdominal girth. Is that more important than encourage fluid intake? I should not encourage fluid intake because you have overloaded already. But now you're left with what? 1 and 2. Do you hold Digoxin if your heart rate apical pulse is less than 70? No. In an adult, we assume this patient is an adult. If it's a child, I will tell you. In an adult, look, you hold it if it's less than 60. Therefore, number 2 is the best answer. Because what do you think? Assess for muscle weakness is asking you for what? Potassium. If I put potassium there, you will pick it. But that word muscle weakness means if you see muscle weakness, patient has hypokalemia. And if they have hypokalemia, they're more likely to have digoxin toxicity. And therefore, that should be the next monitoring. Muscle weakness, hypokalemia, which can increase digoxin toxicity. This is the way you should answer questions. This is the way I want you to approach pharmacology to make it easy. This is a rapid fire, giving you content, asking you questions, trying to break each rationale down so that you understand the why of each question. Number 7, similar question. Save those calculations. Don't worry, we've done it. I'm going to show you again. A provider prescribed cefazolin 400 milligram IV every 8 hours for a child who weighs 25 kilos. Save those ranges what? 25 to 50 milligram per kilo per day in what? Divided Q8 hours. Think about it. What action should the nurse take? This is the key. Now, don't worry about the answer choice at all. Before you look at the answer choice, you got to figure out what is going on. The prescribed dose is said what? 400 milligrams. You're going to get it every 8 hours, 3 times in 24 hours. That will give you what? 1,200 milligrams per day. This is the total dose that was prescribed for the patient. Remember, I've given you kilograms, not pound. Therefore, you don't need to change it anymore. Now, find the safe dose. 25 times 25 is what? 625. That is the minimum safe dose. 25 times 50 is 1,250. That is the maximum safe dose. So our safe dose range is 625 milligram to 1,250 milligram per day. But how much was prescribed? 1,200 milligram. This is within this range. 1,200 milligram is within 625 to 1,250 milligram. This is within the safe dose range. Therefore, which action should the nurse take? The nurse should give the medication. The nurse should question the medication. The nurse should inform the provider about excessive dose prescribed. The nurse should administer half of the medication. No, the nurse should not question this. The nurse should not inform the provider. The nurse should not have the medication. The nurse should give the medication as prescribed because the safe dose range is within the range, because the prescribed dose is within the safe dose range. This is the way you answer it. Like I said, stop the video, watch it again multiple times so that when you see this kind of question, you will master it. Once again, safe dose range is the dose times the weight. And this, since we give it in kilograms, we don't need to convert it. Then you compare it to the available dose and the safe dose, and then you pick your right answer. And 8 is one question by ask you most salient, most important question. NCLEX or nursing school will ask you about anticoagulant. And this is reinforcing teaching for several clients who are receiving anticoagulant therapy by the nurse. Which teaching statement by the nurse is appropriate? Select or apply. Number 1, enoxaparin. You will need weekly lab draw. Number 2, rivaroxaban. Avoid eating green leafy vegetables. Number 3, dabigatran. You will need blood tests at least twice a week. Number 4, heparin sub-Q. Avoid food high in vitamin K. Number 5, warfarin. Keep your intake of green leafy vegetable consistent. Number 6, apixaban. Report any signs of unusual bleeding, such as bruising or pink urine. What do you think? Which of this statement is appropriate? It's better to know all the anticoagulant. I've given you all the classes that is very important for nursing school and the NCLEX. This is pharmacology. And enoxaparin is a form of heparin. You don't need blood draw if you're taking it as a sub-Q. Rivaroxaban is what? It's also anticoagulant. You don't need to change your diet or change how much green leafy vegetables you're going to eat. Dabigatran, you will need blood tests at least twice weekly. This is the same thing as rivaroxaban. They don't need monitoring of your blood level. Heparin sub-Q is the same thing as enoxaparin. You don't need anything regarding food about vitamin K. Warfarin, you need to keep your intake of green leafy vegetables consistent. Don't go up or don't go down. This is appropriate. Pixibam is an anticoagulant. Every anticoagulant, you need to report any unusual bleeding or bruising or pain curing. Therefore, which is appropriate? Only two answers are appropriate. And this is designed to help you master this content regarding anticoagulant. This is what they test on the NCLEX and NSAID school. Number 9. And this is caring for a client receiving continuous enteral tube feeding who is prescribed Phenytoin. This is the same strategy for question 1. What do you think? I told you Phenytoin hates protein. Patient receiving tube feed. Which action should the nurse take when giving the medication? Remember, I don't like protein. Give the medication with the tube feed. What do you think? Flush the tube and mix the medication with the formula. Hold the tube feeding 1 to 2 hours before and after. Type, I'm ready to answer this question in the comment right now and put your answer down. Let me see. Dilute with what? Phenytoin with feeding solution. We all know Phenytoin hates protein. Therefore, there's no way you should mix the tube feed with Phenytoin. What is your answer? What do you think? I know you got it. I believe in you. Put down your answer. Let's check it. Give the medication with the tube feed. Wrong answer. Flush the tube and mix with the medication with the formula. Wrong answer. You hold the tube feed 1 to 2 hours, then you give it to the patient. Then after, you wait 1 to 2 hours before resume the medication. This is the concept. Therefore, the mnemonic for Phenytoin is what? Pause the feed, flush it, give flushing, and restart the tube feed. This is the way we answer this kind of question. Test-taking strategy, master this. Next question. A nurse is caring for a client receiving continuous enteral tube feeding through a PEG tube who is receiving what? Ciprofloxacin. This is the same medication using this is a different medication, but using the same content. There's a reason why you see these follow each other. I want you to show you something in case you see on the NCLEX or nursing school. Ciprofloxacin has the same strategy as what? Phenytoin. Which action you should take? Patient is receiving tube feed. Hold the feeding 1 hour before and after the medication. Stop the feeding 2 hours before and 4 hours after the medication. Give the medication with extra water and resume the feeding. Mix the ciprofloxacin with formula to reduce gastric irritation. There's specific answer regarding ciprofloxacin. There's also specific answer for carbamazepine. There's also specific answer for Phenytoin that we saw. I'm going to give it to you. It's not 1 hour. Like I said, it's not 1 hour. So 1 hour, number 1 is wrong. Number 3 and 4 are also wrong. You can mix ciprofloxacin with tube feed because of the content of tube feed. Calcium, magnesium, and protein in the food bind to ciprofloxacin and prevent absorption. Unfortunately, you cannot stop the tube feed just 1 hour. You have to hold it for 2 hours like Phenytoin. But when you starting it back, 4 hours instead of 1 to 2 hours like Phenytoin. Therefore, the right answer is number 2. Test-taking strategy, 10 questions, NCLEX Pharmacology for nursing students, NCLEX review, practice questions and answers. Thank you for watching, and I hope you learned something. If you need more, subscribe to Adapt NCLEX. If the video helped you, share with your friend, put down your comment, let us know how we're doing. Take care of yourself and bye.